Hello, hello, hello. What is going on? Welcome back. This is Dr. DeLon Canterbury, CEO and founder of GeriatRx. And we are again coming back with our red pill versus blue pill web series where we talk about ways that you, as a senior care provider, can monetize and leverage stopping harmful medications in our seniors as a means to advocate for our patients. So I hope today greets you well. Again, my name is Dr. DeLong Mark Canterbury. I am the CEO and founder of GeriatRx and am here today to teach you ways that you can start implementing deprescribing, which is the movement in healthcare and stopping harmful medication use in our seniors. So I hope today greets you well. We're going to talk more about how senior care providers and advocates can learn my personal top secrets to advocate for over-medicated seniors while using this as a potential honestly value-based tool that you can use in your practice. And so we're going to talk more about how our healthcare system is ineffective and how it's wasting time and money, not just for providers alone, but literally for our healthcare, uh, honestly, for our healthcare providers as well as our seniors who are going through this broken healthcare system. So, again, we are looking for ways to train people on how they can start saving money, how they can start honestly leveraging their business and using deprescribing as a value added service. So, again, your chief deprescriber is here trying to wake you up from this horrible matrix where we are consistently choosing the blue pill over the red pill, which unleashes the potential we have in breaking through this horrible healthcare system. So, let's get down to it. Let's get down to it. What are the true pain points that our providers are going through, our senior care patients are going through as they try to maneuver how to get off of these harmful medications? And so, unfortunately, tons and tons of patients are wasting away taking a bunch of meds that they may not truly need. And so, why aren't we using pharmacists at the top of their license to really help guide them along, potentially stopping some of these harmful medications? And so it is truly doable. It's not something that's like a myth or this unicorn of impossibility. I guarantee you that it is completely possible to get your loved one off of harmful medications, but more importantly, you as a provider can use this as a service, as a value added service to really augment the level of patient care, customer satisfaction, and quality measures that you are seeking in your patient outcomes. So let's talk about that today. Let's talk about how frustrating it is to get dinged for unnecessary measures in our insurance system that reimburses pretty much next to nothing for pharmacists to provide these types of services. But really, let's get down to the nitty gritty. The truth is, on average, our seniors are over medicated. The truth is, they're taking about 12 to 18 minutes on average to see their primary care physician, maybe every 4 to 6 months. And ultimately, that's not enough time to truly whittle down potential opportunities for harmful medications in our seniors. So, again, we are speaking today to why the system we have already at place just simply doesn't work. But the truth is, our patients don't have a clue that they can get off of some of these harmful medications. They don't even realize that they have an option to even ask their providers on ways that they could safely de-prescribe off of meds that they've been on for decades. And I mean, just today, we had a patient med review that was conducted, and the patient was 84 years old, and they were on 14 medications with a history of coronary artery bypass graft and Parkinson's disease. But they've had health conditions that were well managed, well controlled, and they had no idea that there were some meds that they could potentially stop. In fact, out of the 14 meds that they were on, they could have stopped close to 8 medications clinically if they had permission from their provider. So, without our intervention, again, we are showing how we are deprescribing nearly 50% of the meds that the patient is on to help them still achieve those quality measures in life while maintaining their independence and growing and aging independently and happily at home. So I am not speaking myths. This, again, speaks to the fact that our patients feel helpless in this broken healthcare system. They feel that they don't have a voice. They feel they don't have the backing. They feel they don't know how to even ask if it's possible to get off some of these medications. And so, again, this is that perpetual cycle of how are we addressing the overall problem of over medicating. And I don't just mean simple opioids. I'm talking about everything under the sun. Okay, this patient had a well-intended metformin prescription on board. They have been on that medication for about 25 years with an A1C of, say, 5.3. So I'm curious to know, one, if they were to stop the metformin, would their A1C still be controlled? I'm going to likely say yes, but I don't know that. But even so, the patient themselves didn't even think that was an opportunity for stopping the medication, right? They didn't even think that was a choice. It was like, whoa, wait, he's controlled, so we can actually stop it? Really? The power of a pharmacist reigns true. So we have a duty as senior care organizations. I don't care if you're an Alzheimer's organization or Parkinson's or a caregiver support group or just a simple referral source or area office on aging and agency. They didn't think they had the power to still advocate for these very same patients that are over medicated. So what we do in our program is to train you how to ask those questions, how to literally deep dive into meds that you once thought were appropriate, but no longer are quite needed. So again, this patient was meeting their goals. They were doing well. All I did today was ask, hey, how are you doing on metformin? Okay, you're controlled. You're doing great. Have you checked your sugars without the metformin? How are you doing generally? And if it's fine, we have an opportunity to stop this medication. All we did today was go through about all their meds, of course, and just at a surface level view of the medications they were on, we found half of the medications they were prescribed could have been deprescribed or will be deprescribed once they conduct a conversation with their provider. Half. So they were at 14 minutes with hypertension, Parkinson's disease, post-Cabbage which is a coronary artery bypass graft. They also had some urinary issues. They had omeprazole for no reason, just on their profile. Again, this is another patient who came to me who was like, yo, my loved one is overmedicated. What can you do, Delon, to help us get off these meds? So in just 1 hour, we were able to successfully deprescribe half the medications that they were technically on right now. Half. So what patients truly want is just freedom from these meds. They want their quality of life back for sure, but they just want freedom from medications that are causing harm. It's not that hard. They want to be able to have a second pair of eyes looking at their meds, looking at what's healthy for them, and telling them and giving them concrete evidence that, hey, we can actually stop this with your doctor's permission. And so, again, I'm speaking to the issue of how we are so quick to add on a medication without really checking if it's truly necessary. And we can stop this if we truly put in that type of effort and really put in that type of care and change the way our broken healthcare system reimburses these types of interventions that truly save our patients money, for one, but particularly reduce pill burden and improve quality of life. And of course, inadvertently reduce potential harm when it comes to potential side effects or drug interactions or any other type of interaction that may come about because of the medications on board. Why aren't we thinking of this as a potential standard of care? That is the issue I'm speaking to. And what I'm trying to show you all is that you can literally change the way you deliver your practice. You could change the way that you provide medication management by selling and monetizing and leveraging your expertise as a deprescribing advocate, while again stopping harm and reducing patient adverse events by literally just getting them off of meds that they don't need. It's not rocket science. I swear to you, it's not. So the pain point is we're in a place where we've been hit by COVID. We have providers who are in these senior care organizations who want to do all they can to help their patients, yet and still, they are not getting adequately reimbursed for these types of services. So let's change the game. Let's break away from our healthcare system, which tells us we have to do X, Y, Z, and start focusing on the value that senior care providers can give, while again growing your brand, while monetizing and positioning yourself as the expert in deprescribing, and still coming out with quality results, quality metrics, quality outcomes, quality of life that help our patients to the nth degree. This isn't a fairy tale, okay? I am doing this literally with my patients one at a time. And I want to show you how to do it. I want to show you that it's not as hard as you think, and that you still have the ability to still monetize deprescribing and sell that as a service to people in need. I don't care if you're a pharmacist. I don't care if you're a nurse. I don't care if you're a social worker. I don't care if you're a gerontologist. I don't care if you're a PT, OT, ST. Don't really care. What I do care about is your passion for stopping harmful medications in our senior patients. And if you have that baseline passion and want to monetize that, there is hope. So why are you experiencing so much frustration in our healthcare system? I'll tell you why, because guess what? I was there not too long ago. I was feeling that there was no lack of guidance. There was no way to really leverage pharmacists at the top of their license when I was in my retail corner trying to figure out how to help my patient, but I couldn't because I was confined to the laws and really the metrics of where I was working. But I'm telling you, as a pharmacist, whether you're a nurse, a gerontologist, a social worker, a clinician, if you are listening now and you help patients who identify with the senior demographic, you have full opportunity, endless opportunity to stop them from taking meds that may be overwhelming them or causing adherence or noncompliance issues, or maybe again, showing how this new wave of changing our medication mindset can truly, truly grow your business while again advocating for those overmedicated seniors that come into your clinic. It's completely doable. So instead of following the status quo, instead of waiting for a reimbursement from some insurance company, why not just sell that very same service you're using as a value-added tool, but more importantly, as a way to reach those patients' lives and drive those outcomes that the patient wants more than just simply checking off a checklist. It can be done. It's being done. The issue is our broken healthcare system is so reactive and so focused on the archaic fee-for-service model that we aren't looking at the opportunities in front of us. We're not even thinking about our meds as a potential source of harm for seniors. So if we're not even ruling out the obvious, then how can we expect seniors to meet these extravagant healthcare goals and not even have an idea of what the hell the medications are doing? Doesn't make sense because 80% of healthcare is medication based. And if we know that half $1 trillion are being wasted on medications that are being mismanaged and leading to side effects that lead to people being sent to the ER and being sent back to the doctor's office for preventable drug interactions, then damn right, we got to do better. We got to do way better in our healthcare system to help that number go down, because we have a duty as senior care providers to really advocate and push the needle against harm for our most vulnerable populations. So what you need to start thinking is, what is the opposite? What's the counterintuitive thing that we can do as senior care clinicians, pharmacists, nurses, social workers, gerontologists, nursing homes, people in caregiver advocacy groups? What's the opposite way of thinking that we can start integrating into our practice now to not only grow our business, but to more importantly, save some damn lives? Number one, get your own pharmacist. Partner with a pharmacist. Learn how pharmacists can not only advocate for caregivers, but can be a value-added revenue stream for your business. Hire a pharmacist. Contract with them. I promise you, they're going to reduce not only the pill burden on patients, but they're going to damn sure save some lives for those who are on duplicate therapies, drug interactions, side effects, mismanaged, well-intentioned, but mismanaged prescriptions and therapies that aren't they're just not cutting it. Develop a health deprescribing action plan with your pharmacist. Investigate whether your patients are notoriously on 10, 15, 20 medications. If they're on multiple medications, then you already are seeing a problem if you're touching patients. You're already seeing that they need some type of intervention, because statistically, that means that they're more likely to be non-compliant, they're more likely to be non-adherent, they're more likely to have side effects, they're more likely to have drug interactions, they're more likely to be unmanaged, they're more likely to have and suffer from genetic drug interactions. They're just a multitude of issues that arise when people are on more and more and more medications. And so again, this comes down to reaching one, teaching one. And so our program teaches senior care providers how they can leverage their pharmacists, how they can leverage the training from our deprescribing accelerator, and how they can pinpoint those harmful meds and use that as a potential life-saving and cash cow for their business. The first thing you want to ask are, how many medications are your patients on? If you're seeing your patients are on an average 10, 15, 20 medications, you have ample opportunity to instill and integrate a deprescribing service. If you're finding patients who are constantly falling, or they're having chronic pain, or if they are really just having a poor quality of life, you have the responsibility as a senior care clinician to advocate and make sure the medications they are taking are not the cause of their problems. You have to make sure your patients are making and meeting their healthcare goals. You got to make sure that you, as a clinician, are also building a substantial case to stop any harm that may be put upon your patient. And this is not impossible. This is doable. This does not take a pharmacist to deprescribe harmful medications. It literally takes you asking the right questions. It takes you wondering, yo, have there been some new side effects with my senior patient? Have they been falling? Have they lost their appetite? Have they been confused lately? Have there been any changes or mood swings? Have there been any issues with pain? Literally, these are the red flags that we train you to identify and use as potential opportunities to, again, stop harmful medication use in seniors. This does not take much work. I guarantee you, it does not. What it does take is a level of passion and a level of commitment to advocate for seniors. And if you are the one who wants to be a part of our movement, who wants to literally change the way that we are rolling these seniors into these nursing homes, like my grandma was, and want to change that so we can have patients gracefully age at home, then we have to talk about the medications. And so I implore you, I advise you again to consider joining our deprescribing accelerator. Learn how we can show you the way to stop harmful medications, and again, leverage what you are already doing as that senior care professional to help save lives and show how leveraging your pharmacist can grow your business. So again, I am Dr. DeLon Canterbury. I hope today was helpful for you. These are some of my secrets that I use to advocate for over-medicated seniors. The number one thing I ask is, are you on more than 5 medications? If you're on more than 5, it's time for a med review. If you're not hitting your healthcare goals and you find yourself still unmanaged with 8 medications for the same health condition, it's time to leverage your pharmacist. It's time to talk about whether the meds are really causing harm or benefit. If you're not, again, well equipped to stop these meds, how are you asking your patients whether they are taking the right meds or not? How do you know that? That's exactly what we train and discuss in our Prescribing Accelerator. So I hope today was helpful. I may come off abrasive, but I am simply passionate because I am tired of people dying from medications that have completely preventable side effects and adverse events. So we don't need to continue to repeat history and choose the blue pill, where if we choose the red pill and break through from this broken system, we can really start moving mountains and showing you how you can leverage your complete business to save these lives and get some money while you can. So I am Dr. DeLon Canterbury, again, founder and CEO of GeriatRx, your chief prescriber. It's been such a pleasure to speak with you today. Take the time to apply, join our Prescribing Accelerator, learn how you can be the linchpin in saving someone's life while, again, growing your business. You guys take care. Such a pleasure, again, to be with you. There'll be more to come tomorrow as we discuss other ways that you can monetize and leverage prescribing. But I want to share you some easy, quick wins while speaking to the mere fact that our broken healthcare system, riddled with COVID, is crippling and buckling underneath the pressure. So we have to advocate and we have to step up for this new change in healthcare. So see you next time. Hope this was helpful, and stay tuned for more. Take care.